certified nursing assistant student from Filipino Institute, and welcome to my discussion for today about angina. What is angina? Angina is a chest pain commonly caused by a reduced blood flow to the heart muscle. Blood carries oxygen which heart muscle needs to survive. When heart muscle is not getting enough oxygen, it is causes condition ischemia. Most common cause of reduced blood flow to the heart muscle is CAD or coronary artery disease. The signs and symptoms of angina may include tightness, pressure, squeezing, or burning in the chest. Pain can feel in the shoulders, arms, and back. The person may be pale, feel faint, and perspire, may have also dyspnea or difficult or labored breathing. Nausea, fatigue, and weakness may also feel, gas or indigestion. There are three types of angina: stable angina, unstable angina, and variant angina. Stable angina is the most common form of angina. Develops when your heart works harder, such as when you exercise or climb stairs. Can usually be predicted, and the pain is usually similar to previous types of chest pain you've experienced before, and it lasts short time, perhaps 5 minutes or less. It disappears sooner if you rest or use your angina medication. Unstable angina. It's a medical emergency. It will happen at rest, even at rest. You may feel different in your usual pattern of angina, usually unexpected and more severe and last longer than stable angina, maybe 30 minutes or longer. It may not disappear even you rest or even you take angina medication, and it may lead also or signal of heart attack. Variant angina usually happens when you're resting and it's open severe. It can trigger dangerous and potentially cardiac arrhythmias. And while heart attacks are uncommon with variant angina, they indeed can occur, producing permanent damage to the heart muscle. The risk factors are people using tobacco, suffering from diabetes, high blood pressure, high blood cholesterol level, family history of heart disease, lack of exercise, obesity, stress. Men older than 45 and women older than 55 have a higher risk than the younger adult. The treatments for angina. Several medication or treatments can improve angina symptoms, including aspirin and other platelet medications such as nitrates, beta blockers, and statins. Diet for angina. You may eat non-fat or low-fat dairy products such as skim milk and low-fat yogurt. Avoid high sodium or salty food. And food that has saturated fats, you have to also avoid large meals that makes you feel overly full. Restrictions. Avoid stress. Stop exercising immediately if you experience angina. Upper body exercises may trigger angina more than lower body exercises because of a higher press or response. An extended warm-up and cool-down may reduce the risk of angina or other cardiovascular complications following exercise. And that's all for now. And remember, if you feel some of the signs and symptoms that I mentioned earlier, you must seek the help of a doctor immediately. Or if you feel severe chest pain, you may call emergency response team and call 911. Thank you for watching. Stay healthy.